Thank you so much. Thank you for having me this afternoon. Thank you, Monica, for the introduction. I'm here on behalf of Canadian Mental Health Association BC Division to talk to you about one of the resources we have that can support you if you're dealing with some anxiety, stress, or worry related to your health, or if you're sometimes the people with chronic conditions might be experiencing depression or maybe symptoms of low mood or worry. I'm here to talk to you today a little bit about a resource that we have available that can help you with many different aspects of your mental health. So today I'm going to speak to one of our services called the BounceBack program. So the BounceBack program has been available in BC since 2008. Interestingly, it was originally developed to support as a tool for physicians to be able to offer their patients who were experiencing chronic illness that was maybe impacting their mental health. So this is a free program. It's evidence-based. We currently do not have a wait list to access, and it's available for all residents of BC who are ages 13 and above. So this is a cognitive behavioral therapy-based program, and I'll talk a little bit more about what cognitive behavioral therapy is in an upcoming slide. So it teaches you CBT skills that can help you manage anything from low mood, if you have some mild to moderate depression or anxiety, even just if you don't necessarily have a diagnosis of depression or anxiety, but maybe you're experiencing some stress or some worry, whether it's related to your health or any other aspects in your life. And our program is funded by the Provincial Health Services Authority. So who is BounceBack for? We generally it's for those who are sort of in that mild to moderate range with your mental health. You may have a formal diagnosis or you may not. We can help you focus on some of the symptoms you're experiencing, like maybe loss of motivation or energy, changes in your sleep, whether that's sleeping more, sleeping less, changes you might be experiencing in your appetite that are connected to your mental health. Even if you're just having some feelings of just feeling low, feeling down, or even feelings of anger or irritability, which when we're talking about anxiety, I think it's one of those things we don't necessarily realize, but oftentimes feeling angry or irritable can be connected to experiencing anxiety or depression. And also really, yeah, again, if you're more on the worry side, just having some worry or stress, having your trouble relaxing, having that constant feeling of feeling nervous or on edge, finding yourself becoming easily annoyed, or just finding that your worrying thoughts are really getting out of control and you're having trouble controlling them. So basically we cover, there's quite a few areas in terms of your mental health that we can focus on with this program. And so and in terms of just what you want to focus on working on, these are just some of the things you can work on with this program. Overcoming some sleep problems. Maybe you're looking at behavior change. So when we talked earlier in the Q&A a little bit about exercise and nutrition, and it can often be really hard to stick to some of those behaviors, especially when you're having challenges with your mental health or not feeling great. So we can help you focus on sort of that aspect. Maybe just looking for some problem-solving skills or coping with some of the challenges you're experiencing. We can help you work on having unhelpful thinking patterns or thoughts that you're experiencing, building relationships, building assertiveness and confidence, managing anger, overcoming avoidance and facing fears, and learning some coping strategies for illness as well. So I'll just kind of add to that. The nice thing about this program is that it's really customizable. So you can work to really focus on what area in particular you want to focus on in terms of improving. So I mentioned earlier, this program is based in cognitive behavioral therapy. So I'll speak a little bit for those of you who may not be familiar what that is. So basically, cognitive behavioral therapy looks at the way we think. So that's the cognitive aspect, and the way we act. So our behaviors. And these are really interconnected. And so within the program, we use what's called a 5 areas assessment. So we look at your life situation. So whether that's a problem or whatever problem or situation you're experiencing, maybe you've just been diagnosed with an illness, you have chronic illness, and you're finding that it's been really challenging to cope. Then we look at those different aspects of that situation. So you're thinking. And I'll use maybe chronic illness as an example here. So you've been diagnosed with a chronic illness. maybe you're experiencing a lot of anxiety, so you have some upcoming scans, some upcoming tests, and you're finding that your worry and stress about the situation is sort of overtaking your thoughts. So that's where the thinking comes in. Maybe you're having some thoughts around, oh, these results are going to be really bad. I can't deal with this. I'm worried. It's all I can think about. This could in turn affect your physical symptoms. So maybe you're having trouble sleeping, or you're finding that you used to really enjoy going out for a walk every day, and you're like, you know what, I don't want to do that today. So you might notice that you're having some, oh, sorry, that's behaviors actually. I skipped around, but you might notice some changes in your behaviors. And then you might also, that thought might also impact your physical symptoms. So maybe you're finding that it's affecting your appetite. And then it can also affect your feelings, right? So you might just, again, have those feelings of just feeling low or down. And so basically, you'll see that there's arrows connecting all of these different aspects. So all of these different things are connected. So our physical symptoms can affect our thinking or our behavior. Our emotions can affect our thinking, our behavior, and all of these things are interconnected. And so what we do is we sort of look at the situation that you're in and approach it from those different areas. In terms of the effectiveness of BounceBack, so as I mentioned, the program's been available since 2008. So we've worked with over 15,000 folks around BC who've completed the program. And we take some pre-scores and post-scores to look at how the program impacts people. And so we find that people generally do see improvements in their mood. We find that people's depression symptoms tend to decrease by 48%, and we tend to see that anxiety symptoms decrease by 50% on average. So this is looking at the average across folks who've gone through the program. I just have a couple of participant testimonials, and then we'll sort of get into more of the content of the program. So I'll read those out. So just to share some, we do collect feedback. So just to share a couple of people's experiences with the program. So someone's saying here, I encourage anyone who is struggling to try BounceBack. It helped me become self-aware, helped me identify problematic behaviors, and provided practical step-based solutions for challenges that I was facing. And then we've got a couple of other quotes, which I have up there that you can read. So in terms of the actual program itself and how you can participate, we actually have 3 different ways that you can engage with the program depending on what works for you. And you might try one and then you might try another. You can do all of them at once. So there's different ways depending on your learning style and how you like to engage. So we have our coaching program. So you get to work one-on-one with a trained BounceBack coach that'll help you focus on learning some cognitive behavioral therapy skills that can help improve your mental health. And then we also have our online program. So maybe if you're just interested in doing something independently and you don't really want to work at that with a coach at that time, that's a great option. It also just allows you to check out the materials and what's available, and you might work through those online materials and then find that you'd like to work with a coach. Or we oftentimes have people who've done the coaching program and they like the online program because it just helps them sort of continue to sort of reinforce the skills that they've learned in the program. And then we also have a video that's available. So there's a series of short videos that you can watch, and they're great if you're just looking for some quick practical tips that you can take right away and apply in terms of improving your mental health. So I'll speak a little bit specifically to the coaching program right now. So generally people do about 4 to 6 sessions, and it's done over the phone. So the great thing about this program is that you can do it wherever you are in BC. You can do it from the comfort of your home. You don't have to worry about, getting out, leaving your house to an appointment. So it's very flexible. The coaching sessions tend to be about 30 minutes each. And it's flexible in terms of how you want to do those sessions. So people tend to spread them out. You could do it every 2 weeks because there is some activities that you can do in between the sessions. So there is good to have a bit of space between each session. But some people like to spread those out a little bit longer. So this program is really flexible in terms of what works for you and your schedule. We have a series of 20 workbooks, so I'll speak to those a little bit further on so you can see some of the different topics we cover. And you don't have to do all 20. The point is that we offer a lot of different options, and when working with your coach, you can sort of choose what topics and which workbooks you'd like to focus on. And we also have our coaching and workbooks available. In addition to English, right now we also offer French, Cantonese, and Punjabi as well. And then in terms of what is a coach? So, we've heard like of coaches in terms of sports and things like that. So what does it mean, in terms of being a coach as opposed to maybe seeing a counselor? So the role of the coach is really to provide you with that support and encouragement, to help you problem solve, to help you review what you've covered in the materials, answer any questions you have, help to sort of keep you motivated, and also just that accountability. It's just nice to have someone that you can check in with. So it's different from counseling. They're not counselors, and sometimes people find that they might do the coaching program and find that what they need is a counselor as well. So that's a little bit of a different area, but really they're there to sort of be your guide, be someone who can help you problem solve, check in with you, and help you apply some of the concepts that you'll learn in the program to your life. And then this is just a little bit more detail about what the coaching program actually looks like, and what your sort of what it'll look like when you start. So your first session is really just that opportunity to learn a bit about the program, answer any questions you might have, especially if you're not sure if it's something you want to do. It's just that opportunity to find out more about the program, make sure that it's the right type of support you're looking for, get to know your coach a little bit, figure out what type of schedule works for you in terms of setting up your sessions, and yeah, just that sort of getting to know you piece. And then in terms of your regular coaching sessions, you'll review the different workbooks you've worked on. You'll discuss any problems or challenges, maybe some places where you're getting stuck. Talk a little bit about how what you're learning you can apply to your own life, and then make a plan for until your next session. So I mentioned people generally do about 4 to 6 sessions. And then once you've completed the program, we also offer booster sections, which are optional. So you can do up to 2 booster sections, especially if you finish the program and you find that you just need to check in or need a little bit more support. We do have those available as well. So the program materials, I've just listed some of the different topics that we cover. And again, you don't have to do all of these. You'll work with your coach to kind of see where you want to start and where you want to focus. So our workbooks are split into core depression and core anxiety, and then we have some other additional topics. So depression focuses on understanding your low mood and depression, and changing those extreme and unhelpful thoughts you might be having. Anxiety focuses on worry and stress. Also, we sort of get into worry and stress specifically related to illness, and understanding panic and phobias if that's something that you're struggling with. So you can, again, you work with your coach to choose where you want to focus on. A lot of people who have anxiety, a lot of people actually might have both. So you might be feeling some depression and some anxiety. And so you can focus on one or the other. If you want to focus on both, that's something that you can plan through with your coach. We also have other books that get into more specific things like sleep, being assertive, building relationships with family. So we have quite a few optional workbooks as well. And given today that we're sort of focusing, a little bit more on anxiety related to your health and coping with illness, I just wanted to highlight more specifically some of the titles we have related to our core anxiety workbook. So we have specifically one focused around illness, understanding worry and stress, understanding panic and phobias, facing your fears, noticing extreme and unhelpful thinking, changing extreme and unhelpful thinking, and practical problem solving. So again, it looks like a lot, but your coach really knows the materials and can really help tailor this program in terms of specifically what you'd like to work on. So how to access the BounceBack coaching. So right now, it does require, there's 2 different ways you can access it, but does require a referral from a care provider. So it could be your family doctor, it could be your specialist, another type of physician that you're seeing. If you don't have a family physician, you can go to a walk-in clinic and ask for a referral that way, or you can even just, do virtual or telehealth clinic that way. We also accept referrals from nurse practitioners, psychiatrists. For you, this program is available for individuals 13 plus. So for youth who are in school, you can actually get a referral from your school counselor. And for those of you who are familiar with Foundry, so there's clinics around the province that are available for youth, focusing on all aspects of health. Foundry clinics also refer to the program too. And if you don't want to book an appointment to go see your doctor just to get a referral, you can actually just self-refer to the online as well. You just have to provide the name of your physician, but you can do that, and that saves you an appointment, booking an appointment with your doctor. So in terms of program eligibility, we do have some eligibility criteria because again, we want to set you up for success, and we want to make sure that this is the right fit for you. So in terms of our criteria, we do require you to be connected to a care provider that can just provide you some support, just in case the program you need more support than what the program can offer. Also, we have some criteria around not being at current risk of self-harming yourself or others. With alcohol and drug use, it's really just if it's sort of more on the if you're having a lot of challenges with that, that might be a bit of a challenge in terms of engaging with the materials. So that's just sort of on a case-by-case basis. And then not having personality disorder or manic episodes, and that's really just again just related to making sure that this is the right fit for you and setting you up for success. So that was our coaching program. In terms of our BounceBack online program, you can get access to all of the materials that I mentioned online. They're interactive, so you can fill in the workbooks. There's videos you can watch. You can set up like plans for yourself to track your goals. You don't need any referral to access the online programs. You just have to visit the website and sign up. And at the end, I'll show you how you can access all of our resources. And then the video series. So again, if this is sort of the quickest, if you just want to learn some quick tips that you can take away and apply to your life, there's a lot of great stories with people with lived experience who have actually gone through the program, and they talk about their experience. Again, you don't need any referral to access the videos, and we have them available in quite a few languages now, including English, French, Punjabi, Cantonese, Mandarin, Farsi, and Arabic right now. You can access the video online, and I'll highlight that at the end as well. I just wanted to, whenever we're talking about mental health, no matter what's going on in your life, any of us can struggle at any time. So I just wanted to highlight here, I think it's important, just as we know about 911, what to do when, you're in an emergency situation with your physical health, that can happen with your mental health as well. So I think it's always just important to highlight if you're ever, if you or someone you love is at the risk of hurting themselves, you can call 911. But we also have specific mental health crisis services that are available. So the suicide crisis helplines are available. I just wanted to draw attention to the numbers. So 988, which I guess is the equivalent to 911 related to your mental health, is available anywhere in Canada. So you can always text or call. And if you're maybe not in a crisis situation, but you really just want to talk to someone or want to learn more about what resources are available, the mental health support line is available as well, and we've got the number up on the screen here. So that's the BounceBack program. So if you want to learn more about the program, all you need to do is go to bouncebackbc.ca, and everything you need is there. So it tells you how to access the videos, the online program. You can also download a referral form or self-refer online. Everything's on that website. And if you just have questions about the program or want to talk to someone about the program, you can always give us a call or email us as well. Thank you.